Good morning to you. I'm Ashfaq Nazeer, nursing student at IIHS. Today I'm here to present the research I did along with my colleague ADGN, that is cultural competency and the proficiency in providing a cultural competent nursing care among the nurses in Sri Lanka. So these are my contents. So Sri Lanka is a small island where people from different cultures live together in peace. And it is also a very well-known fact that Sri Lanka is a very good point for tourism. So the Sri Lankan government and the authorities are planning to invest around $20 billion on medical tourism. So in the near future, Sri Lankan nurses are going to encounter a variety of cultures. So moving on with my introduction, definition of cultural competency it's really broad. So in a nutshell, if I say cultural competency is basically understanding and respecting each other's cultures. So in nursing, cultural competency is basically practicing nursing with compassion and respecting towards the clients you meet. And if you see this, you can figure out why cultural competency matters in healthcare. So if you see why we were really interested in this research, because cultural competency is an evolving trend in healthcare. Back in the day, this was not given much importance, but with the emergence of the concept of patient-centered care, this has come into the scene. And as I mentioned you before, Sri Lanka is promoting medical tourism. And the study says that in the year 2014, 15% of the patients treated down here in Sri Lanka were foreigners. And also, so far, no research has been done on cultural competency of nurses in Sri Lanka. So we looked into this. So our objectives were to assess the knowledge on cultural competency needed in Sri Lankan practice, and to assess the skill in adjusting the nursing care according to a client's cultural preferences, and to identify the factors that makes the cultural gap between the nurses. So in doing this research, we adopted a cross-sectional mixed method study, and 152 nurses practicing in Colombo were selected upon community and sampling method for the quantitative studies, and 8 well-experienced experts in the Sri Lankan nursing field were participated in the qualitative sample. In the quantitative study, we used a survey questionnaire that we made out of combining several cultural competence assessment tools, along with some case scenarios that it will suit the Sri Lankan setting. And in the face-to-face interviews were made with the expertise in the qualitative study. So moving on with my results, 49% of the sample, they could define the term cultural competency. And 86% of the sample, they really knew why as a nurse they should be culturally competent. That is basically to provide an efficient and effective nursing care respecting the client's cultural preferences. And 94.1%, they believe that a particular client's health would be influenced by their cultural background. And out of the sample, only 58.6% agreed that the nursing care that they should provide those clients should be adjusted according to the client's cultural preferences. And when we assess the perception and awareness, level of awareness, we found out that 92% of the nurses, they agreed that the nurses should be aware of the cultures that they encounter when they go to practice. Out of that, the majority, that is 42% of the sample, they were moderately aware of the cultures that they meet when they practice. And when we compare the level of awareness across the age group, we could find out that with the increase of age and experience, they become more aware on the cultures that they meet in practice. So this shows you the the language competencies, and we found out that 79.6% of the sample, they believe that they could speak English as second language, but only 63.1% were confident in making a communication with the client in English. And out of the whole sample, only 7.9% were able to speak all three languages you need to practice in Sri Lanka, that is English, Tamil and English. But surprisingly, only 2.6% out of them were confident enough to communicate with the client in all three languages. So if you look at the graph at the bottom, you can see almost 90% of the nurses, they feel frustrated when there is a language barrier. And when we looked into this, we found out that 38.2% of the nurses, they believe, they actually agreed that when there is the language barrier, the patient is not responsible to have an interpreter. And 40.8% of the nurses, in such a case, they agree that they feel obligated to learn that language. So when we assess how our nurses are comfortable in working with other cultures, we found out that 65% of the nurses, they feel more comfortable when they meet a client from similar cultural background. Out of that, 46% of them, they said that they feel uncomfortable with other cultures. So this is a significant figure, that is 46% of the sample, like this graph reflects that they are comfortable only to work with clients from their similar cultural background. So our case study result shows that 53% of the nurses, they would consider meat consumption in malnourished nutrition clients, and 42% of the sample, they would consider gender preferences protecting the nursing priorities. That is, if you can remember the picture I showed you at the beginning of my presentation, some of the cultures, they are not comfortable when a healthcare provider, if they are not in the same gender. So 42% of them, they said that they will consider the gender preference protecting the nursing priorities. So the rest 52%, they would consider this, but they will neglect the nursing priorities. And moving on, 51% of the sample, they said that they would allow the religious rituals within the ward when a client is in the palliative care. And here we found one significant figure, that is 26% of the sample, that they denied religious rituals. And the basic, their main reason for this was, they mentioned that the clients who were in the palliative care, practicing religious rituals are not much important. And out of our sample, 68% of them, they agreed that they would help to identify a responsible person to share an HIV client's medical information. So from our qualitative studies, we could identify two themes as factors that influence the cultural competencies between the cultural competency gap between the nurses. So one of those was the attitude, the inbuilt attitude within the nurses. That was the internal factor we could find out. And many of the nurses we interviewed, they came up with the idea that cultural competency is not something that can be taught to someone. So that should come from yourself. That is basically willingness to change and adjusting with other cultures. And we were also told that most of the nurses in Sri Lanka, they have very poor interest towards continual learning process. So with the bachelors, they stop their studies because of the responsibilities and heavy work schedules. And also we were told that though the hospitals and the authorities, they organize certain events, cultural and social events, most of them were not willing to participate. So the other factor we found out was the exposure to different cultures. That was the external factor. So exposure is basically, that could be a theoretical exposure or maybe practical exposure. So when we were told that, most of the nurses told us that during their studies, when they were taught about cultural competencies, it was not given much importance, and very few number of hours were taught on cultural competencies. And they told us that was taught only in the first semester or the first year of their studies. So what they told us was, like with the time, as the theoretical exposure is not continued, like they tend to lose their practices. And also they said, like in the student period, when they go out to the clinical placements, the exposure for the different cultures were regulated by their tutors. So moving on with my discussion, we could conclude that nurses of all age groups had satisfactory knowledge on cultural competencies, but in general we could find out the practical application is really poor. And also, with the quantitative studies, we could conclude that they had a good language competency, but with the interviews that we held with the expertise, like they confirmed that it is very poor. And also we could find out that young nurses are more competent in language wise, whereas with the experience and age, they become more competent culturally. So this is the perception of a Sri Lankan nurse on cultural competencies. When we asked about the cultural competency, they were just concentrated only on language. But there are so many other factors of cultures which is hidden. So if we recommend something, we have to recommend something to expose all these hidden areas of culture. So moving on with my recommendations, we recommend the Health Ministry and other authorities to revise nursing syllabus annually. So like they can increase the study hours, and also this should be taught continuously. No, this shouldn't be like stopped with the basic nursing. So even in post-basic nursing studies, this should be taught. And they could organize many social and cultural events so that the nurses can participate and improve their understanding on other cultures. And also one more recommendation was that the hospitals can adopt a monitoring system so that they could monitor the client satisfaction with nurses. So it will give you a feedback how culturally competent they are. And also ongoing research should be done on this topic to continuously evaluate how culturally competent our nurses are. These are my references.